Alright guys, I'm going to do a full head-to-toe assessment. We've got paged out to an ejection. I'm going to make sure that my scene is safe. I'm going to ask for additional resources. I don't want to do this all alone, so I'm going to make sure that more people are coming. I'm going to ask for somebody to do traffic, whether it's troopers or police. Make sure that my scene is safe, communicate with my team to make sure that they're safe, and I'm wear the appropriate PPE. I'm going to not wear safety glasses on this demonstration because I honestly can't find mine, but I am going to be wearing gloves, so BSI, my scene is safe. I have one patient. I've asked for additional resources. As I approach the patient, I'm going to see if he makes any movement towards me. At this time, he doesn't look like he's very alert. I approach. He does not make any movement. I'm going to shout out to him, "Hey, sir, can you look at me?" He's not going to move. I'm going to continue to approach my patient and then do my assessment. Sir, can you hear me? Can you hear me? No response, no response. Check airway, breathing, circulation. He does have a pulse. He's breathing at about 6 times a minute. And it's appropriate. I'm going to look in his airway here. I do see some vomitus. We're going to suck this stuff up. I'm going to have my partner do a jaw thrust maneuver on him. We don't know how much damage has been done. So his airway's clear. I'm also, because he's only breathing at 6 times a minute, I'm going to have my partner start bagging him at 12 times per minute. We're going to put an OPA in since he's unresponsive. We're going to protect his airway. I've checked the pulse. He looks pale, so I imagine he's going into some sort of shock. I'm going to do a quick hemorrhage sweep. So I'm going to check the blood, all the way down. I don't find any significant bleeding on him. Nope. So I've checked airway, breathing, circulation. This patient is super sick, so he is a load and go patient. I'm going to start with my DCAP ATLS, deformities, contusions, abrasions, penetrations, burns, tenderness, lacerations, and swelling. I'm going to check his head. I don't see any DCAP ATLS. I'm going to check his pupils. They're pearl. I'm going to look in his ears. I don't see any fluid. I'm going to look in his nose. His airway's still clear. If it filled up with blood or vomit, we could suction airway again. I'm going to check his neck. Trachea is midline, no JVD. And we're going to go ahead and size and place a C-collar. I'm going to remove his clothes. I'm going to check his collarbone, check his chest, check his sternum, continue to check the chest. I'm going to listen with my stethoscope, high and wet. I have equal lung sounds bilaterally. I'm going to check his abdomen. I'm checking for rigidity and distension. I don't feel any. I'm going to check his pelvis, both down. I'm going to check his limbs. I'm going to cut his pants off. I'm going to take his shoes off. I'm going to check his pulse. Pulses are equal. Sir, can you push down on my hands? Can you feel me? Check his arms. Check pulses. I've got good equal pulse. At this time, I've got my partner at the head. They're holding the head. They're bagging him at 12 times per minute. We need to get him out of here onto the backboard. So we also need to look at his back. So on heads count, I'm going to have the person at the head count. I'm going to have a partner here that's going to assist me. We're going to roll him up. Heads count 1, 2, 3. When we roll him up like this, you're going to expose the back. Because the back of the body, this is the back of the lungs as well. This is the back of the abdomen. So when you want to make sure that there's no blood, there's no holes. So you're going to feel the spine all the way down. You don't want to feel any step off, which is basically like if your spinal column looks like this, if it's one's up or one down, you can feel that they're checking all the way down. This is the last time you're going to see the back. So you want to make sure you get a good look at it. Backboard will come in. On heads count, we'll move them onto the backboard. 1, 2, 3. Move them onto the backboard, secure them onto the backboard, and get them going to the hospital. This is where you can get your history. If there was anyone on scene, you can get a history from the patient if they're awake. You can get history from other bystanders, if they know them, friends, family, the trooper that's been doing the investigation. Get a set of vitals. You can use the limbs to get a set of vitals depending on what the injuries are. and then you're going to want to start your treatment. To do your secondary assessment, it's more focused. So let's say that he had a large bruise here, he had good lung sounds. So my second way through, I need to pay attention when I do my lung sounds that this is a priority type area because everybody needs airway breathing circulation. And his breathing is fine, we want to make sure that it stays fine. So that is assessment head to toe. If you guys have any questions, let me know.